Hello, I'm Grant Mary, Campbell nursing student, and here is chapter 23, Neurologic Function of the Anatomy of the Central Nervous System and Peripheral Nervous System. Okay, so you can find a helpful Quizlet online. Here's the link if you want to pause and copy that down. Functional anatomy of the central nervous system and peripheral nervous system, pages 633 to 636. So the cerebral cortex as the frontal lobe, these are important, remember their functions, is concerned with personality. Lobe is concerned with behavior, emotions, intelligence. Frontal lobe, personality, front lip. You can think front flip. You can think frontal lobe, intrapersonal skills. Lip. By the way, this isn't developed fully till age 25, so some people say you really don't know yourself till you're 25. Parietal lobe is for sensation. PS, parietal sensation. Temporal lobe is primary hearing receptor for taste and smell. Wernicke's area is the language comprehension area. Walk, Wernicke's area, language comprehension. And the final area is Broca's area, which mediates motor speech. BAMS, Broca's area, mediates motor speech. BAMS. Then you have the basal ganglia, which is large gray bands with two cerebral hemispheres to initiate movement. Thalamus, which main relay station to the central cortex. Then you have the hypothalamus, which is the respiratory center in charge of vital signs. Then you have the cerebellum, which is in charge of equilibrium, coordination, and the midbrain, which contains many motor neurons and tracts. Pons, which coordinates respiration. The pontine respiratory group, you don't need to know that for the test, so if you want to just ignore it, you can. I'll just take 5 seconds. The pontine respiratory group mediates the respiration rate, so it's the central nervous system for respiration instead of cardiovascular. So the medulla assists in respiration, cranial nerve 8 and 12. So it also assists in hearing, balance, etc. And 12, which is tongue movement. Spinal cord mediates reflexes. As you don't think, you just act with reflexes. So the spinal cord is the primary receptor for those. The central nervous system includes the spinothalamic tract. The spinothalamic tract contains sensory fibers that transmit the sensation of pain, temperature, and crude or light touch. The central nervous system also has posterior columns, posterior position proprioceptors. Without looking, you know where your body parts are in space in relation to one another. So vibration, you can feel vibrating objects through the posterior columns of the CNS. And finally, localized touch, sternogenosis. Without looking, you can identify familiar objects. The peripheral nervous system has a reflex arc, which is deep tendon reflex, knee-jerk patella, superficial corneal reflex to light, perla, 3 visceral organic pubular light reflex, perla, and pathologic abnormal Bamsky reflex. So the cranial nerves, which are important, I believe the professor mentioned that in her slides at least 3 times. So you have olfactory sensory smell, optic sensory vision, ocular motor both, trochlear motor, trigeminal both, uh, abducens motor, lateral eye movement, and if you remember, it's 3, 4, and 6 for the eye region test. That's what you test, is the third, the fourth, and the sixth. So, 6 cardinal positions. This is 6. This is 3 and 4. So then you have facial, which is both. You have acoustic, which is sensory. You have glossal pharyngeal, which is both. Pronation and swallowing, taste, gag reflex. Vagus, which is both. Talking and swallowing. It is involved with a lot of the smooth muscle of the digestive tract. The spinal accessory, which is motor movement of the traps and sternomastoid muscles. You test that with shrugs. And then you have the hypoglossal, which is movement of the tongue, outwards, upwards, downwards, left and right. And those are the spinal nerves. A few mnemonics for those are ooh, 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 to touch and feel. Vestibular cochlear, which is V, good, vagus, accessory nerve, and hypoglossal. There's a crass way to remember these, but I will not put it. I will say to feel very good vagus nerves and hypoglossal nerves. I guess if you're like reaching inside of the brain or something. And to remember if they're sensory, motor, or both, you can say, some say marry money, but my brother says big brains matter more. So that's actually motor. Some say marry money, but my brother says big brains matter more. Okay. And that's all I have for the functional anatomy of the central nervous system and peripheral nervous system. Have a good day.